Hi, it's Lucy. I was just wanting to check in and give you an update with everything that's happening. Things seem to be progressing faster than even I can process at the moment. I had surgery on Monday, which has been a bit of a surprise to me and a surprise to most people I know. I went in last week to have a conversation with one of the doctors, and while I was there I said, the bottom side of my left incision seems to be a bit inflamed. I think it might be a stitch that's got infected, or some scarring is occurring around the stitch. So the surgeons took a look and said that they weren't happy about it, so they asked me to come back the following morning, which was Friday, and have a biopsy and an ultrasound, which is what they did. And they told me that it was cancer. So in less than 5 weeks from my surgery to remove the other tumours, a new tumour was growing in the incision of the previous surgery. So they were really sweet and they said, well, the least we can do is put you first on the list on Monday morning to cut this out. So I went in at 7 o'clock on Monday morning, saw the surgeons, the anaesthetist, the nurses. I had my friend with me, and woke up a few hours later. It's the first time that I've woken up and I still have my eyes closed and I was still sedated, but I could feel them pulling the intubation tube out, which was a very strange sensation. Obviously they were quite big, so they fill your throat, and the recovery nurse was really sweet and we had a good chat, and then up to the ward. So it was just a day surgery because it wasn't a particularly big operation. They just opened the same incision up and then scooped out the tumour that was in the sitting there and took that away and then sewed me up again. I did come out with a drain, which is lovely. And I'm going back to the hospital in a few minutes to go and see the surgeons so they can have a look. And I also am going for a consultation with my radiotherapy consultant to talk about the next steps, which looks likely to be radiotherapy in probably October, but we need to go through a few steps first of planning and scans and things. But after my friend left yesterday, pretty much within the hour of her leaving my flat, I had an accident, and this, which is supposed to still be attached to my body, is not attached to my body. So it got caught on something and it yanked, and because it's a vacuum pump, I suddenly heard this huge and obviously there were lots of expletives as I was running around trying to find the items I needed to then deal with it. So I won't show you the incision now because I've got dressed and it takes a lot of time to get undressed at the moment because obviously there's some pain and there's some discomfort. So I changed, so I cleaned it up and wrapped it, and I've stuck it down to the side of my body so that no germs can get into it. And then I spoke to the nurses who told me I'd done everything perfectly, so I was very proud of myself. The doctors have been great. I'm obviously nervous about how fast this cancer is now growing and doing its thing. Time has passed between these different occasions before, and it's just quite shocking how quickly this thing is coming back and how we're all struggling to keep on top of it, and it's spreading and it's doing what cancer does, which is tries to consume you, and we are trying to not allow it to do that, but it is having a good go. Anyway, I need to go because my neighbour is coming to collect me to drive me to the station, and I need to go and get this dealt with. Ew. Bye. So I'm back from the hospital and I saw a few different people today, and I saw my surgeon, who didn't seem too fussed about the fact that I'd pulled out my drain. They removed the bit that was attached to my scar, and it seems to not be draining very much anyway, so they were going to take out the drain, so that's good. So that's gone, and they are a bit concerned that the area is very red, and I've not been feeling very good for the last couple of days, so I have come home with a stack of antibiotics to take, and the idea is that if I'm not feeling better by tomorrow, then I need to go back to the hospital where they'll prescribe me something stronger, or they'll admit me. I think admitting me to hospital at the moment is a bit of a stretch. I just need to take these antibiotics as they tell me and get a good night's sleep so that I can be the best that I can tomorrow, so hopefully I feel better. Their concern about it is that going into the weekend potentially with an infection taking hold, they want to avoid that, so they want to make sure that I'm feeling okay before the weekend, so that's good. The other part was I saw my radiotherapy consultant, and we went through, you have to do this with any surgery, chemotherapy or radiotherapy, or any treatment plan that you have with the NHS, that you always have to do a consent form. So today I went through the consent form with my radiotherapy consultant, and what that means is she explicitly tells me what potential side effects are of that treatment, and what the short-term and long-term effects can be. So for example, redness, soreness, swelling, possible lymphedema, stiffness of the shoulders, so lots of different things, but they have to tell you the most extreme things that can happen. It's a bit like when you go for an operation, they'll always say, you know, that when they're filling in the form, obviously the worst thing that could happen during surgery would be death, but that's very, the risk of that is extremely low. They wouldn't put you through a surgery if they actually thought the risk of that was high, unless it was a life-threatening situation, an emergency surgery. So these forms are intended to cover everybody and make sure that everything is listed that could happen. And it's good because it means that the patient is aware of what's happening to them, and I think that reality is important for everybody to understand. So it was a good day. Just a shame about this possible infection that I have. So I'm going to have some dinner and rest up, and hopefully get an early night to make sure that I am rested. So on that note, I say farewell. Bye bye.